let's go to the U.S. Army Special Forces Medical Handbook. And so, the first chapter is about integumentary systems, which is, can anyone tell me, class? Anyone tell me what is the integumentary system? That's right, it is your skin. To understand skin diseases, you need to understand some basics. And I'm going to show you some pictures to help you understand those basics. I'm going to show you a picture of a macule. This is a macule. Okay. A macule is a flat, discolored spot of varied size, but it has to be 10 millimeters or smaller, or it is not a macule. These are just different ways to describe skin lesions so that you can better and that other picture is wrong. That picture of hands, those are not macules. Those are big enough now to become patches because they're bigger than 10 milliliters. That's why you can't just Google stuff. A doctor has to tell you things are wrong. But you can Google stuff and then ask your doctor and be like, hey, what about this? And then they can use their brain. And you guys can work together. That's what a doctor's supposed to be, your teammate in helping you to figure these things out and find the best solutions for you. So anyway, that's a macule. And these are not specific diseases, these are just so you can understand how to describe different skin lesions, and so that when skin lesions are being described to you, you know like what diseases they're more likely to have, because some diseases are more likely to have macules, some diseases are more likely to have papules and so forth. A papule is the next thing. I will show you a picture of a papule. There are no good pictures here. This is kind of a picture of a papule. That's more like a pimple there. Here. That's a papule. Okay. That is a papule. A papule is a solid, elevated lesion, 10 millimeters or smaller. So it's the same as a macule, but it's raised instead of being flat. So a little round circle. A patch is when a macule is bigger than 10 milliliters. So that's easy. So that's why I told you that person's hands that we saw. That person who had vitiligo. That person had patches. They were already bigger than 10 millimeters. A macule is flat. A papule is raised. A plaque is a group of papules that are all together. So it's like a raised patch. So you have macule, less than 10 milliliters. Patch, more than 10 millimeters. Papule, which is a little raised bump, smaller than 10 millimeters. And then a plaque is a raised area bigger than 10 millimeters. Okay, so that's pretty easy. A nodule is when you have a palpable solid lesion. A papule is a bump. A nodule is like, there's like a circle and you can kind of feel part of it's under the surface, but it may or may not be elevated. It could be under the skin and you can be like, oh, there's a nodule under there. And tumors are large nodules that are usually more than 20 millimeters. More than 20 millimeters. Vesicles. I'll show you what a vesicle is. A vesicle is a papule that's hollow. So this is a vesicle. Like in herpes. This is a vesicle. It's like a tiny blister. Oh, come on. Give me a human picture of a vesicle, please. These are vesicles. It's really weird because it didn't used to be this way, but now looking at certain skin stuff gives me tingles, and it's not entirely comfortable tingles. It's kind of weird. I didn't used to be that way at all. I don't understand. So like I pulled up this vesicles and I was like immediately like, oh, I have tingles. But they're like weird tingles. Circumscribed elevated lesion, 5 millimeters or smaller, containing serous fluid. Serous fluid means it's clear. It's clear. If it has pus in it, it is a pustule. Right, so this is a vesicle. It's like a tiny, tiny blister. Okay. So, or a bulla, or bulle. Bulle is a big, like a blister. That's the word for monster, basically. But like this. This is a bulle. Okay? That's more than 5 millimeters. So for macules and papules, the cutoff is 10 millimeters. Okay? For vesicles and bullae, the cutoff is 5 millimeters. Okay? And then a wheal, I'll show you what a wheal is. It's like a welt. Wheal. It's like a transient local elevation. And that's a butt, I think. Kind of like this. Yeah, this is a wheal. I don't know why someone did that to someone or themselves. It seems ungood. It seems like not the right thing. But those are wheels. And that's not a butt. That's not a butt. Don't be angry at me, Twitch, okay? Don't be mad at me, Twitch. Exactly. Schoolie JB's got it. Schoolie JB's learning the things. Oh, I love you. It's so great to have you here, Schoolie. Alright, so those are primary lesions. Secondary lesions happen when the primary lesion turns into something else, okay? Or if you scratched yourself. Like, so scales happen when you have a lot of little plaques start to build up on each other. The body responds and starts to build up epithelium on top of it. Crusts or scabs, right, happen when the body dries. You know, like blood, serum, or pus. So all these secondary lesions are reactions that happen either naturally or because you did something to the primary lesion. Erosion is when, because of inflammation, you lose part of your epidermis, and an ulcer is a deeper erosion, right? It's a hole in your skin, basically. Excoriation is because you were scratching it. Lichenification is when the skin becomes really thick because of like different inflammation. Women of a certain age can get some like white lichenification on their vulva, and you have to check and make sure it's not cancerous. Atrophy is when the opposite, the skin like really thins or wrinkles, becomes like cigarette paper. It becomes like cigarette paper. And of course a scar, or you can have a keloid, which is a big raised scar, especially in darker skinned individuals. Sometimes depending on how the skin heals, you can get large raised scars. Aloe vera, it really helps to prevent keloids and scarring. It makes a really, really big difference. So that's something you can try after the initial burn, injury, whatever else it should be. You can also definitely check out the video on Becoming a Real Life Superhero channel about burns and how to help other people like not get burns, protect them from fire, things like that. So those are some basics. So now you're gonna learn another set of basics, which is itching. Pruritus is how we call itching. Compulsive itching accompanies primary skin disease or may be the only sign and symptom. Redness or urticarial papules, excoriated papules, fissures, crusting. So, as you go through the rest of this book, you're going to see that it's in an order called SOAP. S-O-A-P. S being what the patient tells you, the subjective. O being the objective finding that you see. A being your assessment, and P being your plan. And that's the standard note way that we in the medical field like share information with each other on notes. And even when you are presenting to someone, like passing off a patient to someone else, you'll start with your your one-liner that kind of summarizes everything, but then you'll go into those things. That's the O, the A, the P kind of relevant stuff, even though you kind of start with your one-liner. Your S is the most complicated part because that's the symptoms the patient tells you and any relevant like history, other kinds of things in there. So S could be broken up into HPI, the history of the present illness, relevant past medical history, relevant family history, And so for example, I could have an 18-year-old female with what's a really quick, good way to, so, I'm presenting with an 18-year-old female who came into the clinic with a large swelling on her right breast. She describes it as being painful, hot, and itchy. It appeared over a very short period of time, about a week, and her mother has a family history of BRCA1 breast cancer, which was at a very young age. Her grandmother died of breast cancer at 45, and it was metastatic, stage 4, within just a couple of months. And she's presenting because she's concerned about her own breast cancer. And then relevant negatives, like if she could have breast cancer, relevant negatives in that S would be she is not currently breastfeeding, she hasn't had a fever, she hasn't had any discharge from her breast. So within that like S that I just said, I had initial summary, I had her symptoms, relevant family history, a relevant like review of systems with the negatives. The reason I included the negatives is because it's important in knowing what she doesn't have, right? Is this an abscess? Is this mastitis? Or is this inflammatory breast cancer? And that's kind of the information. And then you would go into the objective and say, on my physical exam, and then you go from top to bottom, on my physical exam, and then depending on how detailed you are, it depends on what level of training you are. At a certain level of training, you want to list everything from your general to your, like all the way down the body. For the sake of brevity, when you're presenting on a professional basis, your O is going to be a little bit shorter, only to the relevant things. So, like her vital signs were normal. She didn't have any kind of fever. On physical examination of her breast, she had a large nodule in the right outward, in the right outer quadrant, right in her axilla. The nipple itself had a peau d'orange appearance, and there was a large mass palpated in the entire right outer quadrant of her breast, with the entire breast being swollen and red, right? That's a, that gives you the information, right? So most breast cancer doesn't present like that. Young breast cancer in certain people with certain family histories, which is why I included that, can present like that. Most of the time someone with a swollen breast has mastitis. Usually mastitis or like an abscess. Mastitis is like cellulitis of the breast. It just means you got an infection in those tissues. You need some good antibiotics. You can still keep your breast milk flow going. You can pump and dump if you're taking antibiotics for it. So it's good. That's fine. So the majority of mastitis is like localized. Peau d'orange appearance though, where the nipple is like dimpling or looks like an orange on the outside, those are kind of concerning. And then of course anything in this outer quadrant is concerning, because this node, the lymph node up in the armpit, kind of tells you that's where breast cancers begin, and also that's where they spread out to the rest of the body. So, but you see like how I did it in that order, because it helps other medical professionals to know what's going on and what to expect. And then, if I'm consulting with an expert, I might stop there, or I might say in my assessment, this is, the differential diagnosis, these are the 2 or 3 things I'm concerned about. Obviously, this is the thing I'm most concerned about. And then in my plan, this is what I've done. I'd like to see what you would like to do. Like if I'm consulting with a specialist or trying to share the information and send the patient to a specialist, and I would make it shorter. I would make it like that whole thing in like 4 lines for a specialist, for a consult. But in my patient note, it would be all that stuff in detail, what my plan is and so forth. So that's kind of your, that's SOAP. That's the most important like organizational strategy to understand. And one thing, this book has a lot of errors in it because it's from the 1980s, but a lot of the good information that it has is like kind of teaching people that basic like order of how to arrange things. So this this is not for a doctor, this is for a young medic who has to take care of their battle buddies in a situation where they don't have a doctor. So for them, it's like making it very simple. So like pruritus, they're saying like somebody who comes to you field setting, if someone's itching is driving them crazy, and you know you're special forces, and the guy is gonna get everyone shot with all his itching because he's making a lot of noise. Okay, yeah, Valium. And then most of the time you wouldn't do that because you know getting someone addicted on a benzodiazepine because they were itchy is not the right thing to do. The normal thing you would do is antihistamines. They have here like Benadryl 50 milligrams 3 times a day. That's good. Atarax or hydroxyzine 25 to 75 milligrams 3 times a day or 4 times a day has the advantage in that it's not as drowsy as Benadryl is, which you know in a combat setting that's useful. Also has the benefit that it helps with anxiety. So Atarax or hydroxyzine is what I give after a sexual assault. So I like that recommendation. So you see, like their section on itching is very small, but in reality, like pruritus, like itching is a symptom, not a diagnosis. It shouldn't go in the A section. Like they say here, you could put pruritus as the assessment. No, you cannot. You have to, at least not as a doctor, you shouldn't. That's like saying muscle spasms. I hate it when people put muscle spasms as a diagnosis. Muscle spasms are not a diagnosis. They are a symptom of something else. Like perhaps they are a symptom of an electrolyte imbalance, a dehydration, a muscle strain. A muscle strain is a diagnosis. That's when you were doing something to your back, for example, and you strained your paraspinal muscle, which means you slightly tore some of those tissues, and in response, it's spasming. Muscle spasms can also be secondary to stress. I had a patient one time I was doing osteopathic manipulation therapy on him, trying to treat his back, and it wouldn't fix. I was having so much trouble with it, like he was just spasming so tightly, so I asked him, are you having any alcohol use issues or stress going on? And that is how I uncovered his alcohol use disorder, because he was having stress, he was getting angry, he was afraid of his own angry reaction towards his wife, and so as a result, he was having back pain because he was holding all that stress in, instead of forgetting for how to better manage his relationship with his wife than drinking, because he was finding he would get so angry that he would have thoughts he didn't want, and so then he would go out on the porch to avoid her and drink instead of working through the issue because he was afraid of becoming the kind of person who hurts her. He didn't want to be that person, so to his credit, he avoided instead. When the actual thing is, he needed to like sit and figure out better ways to communicate, cope with his feelings and so forth. And he needed to fix the alcohol use disorder because the alcohol wasn't solving the problem. It was actually making it worse. Okay, it wasn't making it better. It was making it worse. It was making it worse. So, all that to say, a spasm is secondary. It is a symptom of something else, and similarly, pruritus or itching. There is such a thing as idiopathic primary pruritus. That's not normal. Normally, pruritus comes from something else, like contact dermatitis. Like you touched something or that your body is not used to. Your body reacted weirdly to it, a new chemical. Or in some cases, it can become because of a mental injury. Some sexual assault patients or sexual abuse patients will have like intense, no reason vulvar pruritus. Fortunately, none of my patients have had that, but it happens that especially child abuse victims will have regular like itching don't open the door because they'll see you all naked. Okay, thank you. I appreciate you. It's a formula. Yeah, exactly. Yeah, exactly. Dude, you can still become a medic, get your EMT, like, skills, or become a nurse. See the buzz of, yeah, exactly, for patient self-managing. Yeah, you're still young. Basic LVN stuff doesn't take very long, and you can make a big impact on someone's life. Although I think a medic is a better direction. I've always had more luck training and working with medics than with nurses because of the way nursing education is structured currently. I hope this feels really good. It seems like it should. Seems like it should. I'm very happy we finally got these sounds going. How's this in the back of your head? I love that. I'm so happy it's finally working. Yay! It only took us an hour. Only took us an hour to get working. There we go. That's some excellent ASMR. Alright, folks, so that was today. We read a little bit